Good morning. My name is Namratha Kandula, and I'm a researcher and primary care physician at Northwestern University in Chicago, Illinois, in the United States. Why do I want to be an emerging leader in the World Heart Federation's program? As a scientist and primary care physician, I have devoted a large part of my career to trying to answer the question of how can we incorporate the social and cultural determinants of health into cardiovascular disease prevention interventions so that we can reach the most vulnerable communities and communities that are affected by social inequality. I became very passionate about this topic when I was a resident at Bellevue Hospital, the oldest public hospital in the United States. I would see Indian, Pakistani, Bangladeshi immigrants coming into the emergency room with heart attacks and strokes. Many of these people were from very poor communities and had not had proper access to health care, to proper nutrition, or information on how to prevent these chronic diseases. We know how to prevent heart disease and stroke. The problem is that this evidence, this science, rarely gets applied in the communities that need it the most, in the communities that could benefit the most from this information. I'm at an inflection point in my career where I have been extremely lucky to be funded by the National Institutes of Health to test out my ideas about how to incorporate social and cultural determinants of health into cardiovascular disease prevention. I now want to take the most promising ideas that I have and work with scientists, policymakers, non-governmental organizations, and community advocates from around the globe so that I can think about how do we scale up ideas about the social and cultural determinants of health. I also want to ensure that whatever solutions and policies that the World Heart Federation comes up with, that these policies and ideas will consider the perspectives of patients and communities. If we do this together, I'm sure that we can reach our goal of reducing cardiovascular disease by 25% by 2025. Thank you for considering me for this program.